what you can do to change feeding. So I want to start with signs of aspiration. Does everybody know what aspiration is?
When the food goes to the lungs?
Yes. So food or liquid going the wrong way basically and getting into the lungs. The first thing to mention with aspiration is it can be completely silent. You can have no signs that it's occurring, and that makes it very difficult. But some things that you do want to watch out for, or if you notice parents saying that their child is doing this, you definitely want to be concerned and maybe refer them back to their pediatrician, or to, if they're already seeing a specialist, if they're coughing frequently during or after meals, if they have had frequent bouts of pneumonia or just respiratory infections.
I would say frequent for a baby is like 1 a year. That's a lot of pneumonia.
It's enough.
So if you have a baby who's had more than one pneumonia, then
Yes.
that's a lot.
Yes, I agree. Wet gurgly voice, especially after they've eaten or drank something. Color change in skin, lips, or their nails. Temperature spikes after eating. Probably for most of the kids, you're not taking their temperature, but for some of our more involved kids that have nurses that are on oxygen or being monitored, this might be a common thing that you're doing after meals. Gagging, choking, throat clearing, pretty much makes sense during or again after meals. Bouts of apnea or desats in oxygen level. Runny nose and watery eyes is one that people don't often recognize. And there are other signs and symptoms that may or may not be. These are the most common. And aspiration is very dangerous, and so definitely you do want to follow up with referring them back to a physician, probably to get an order for a swallow study for that, or if they're seeing a speech therapist. However, when it comes to feeding, aspiration is not the only issue, and most of the kids that I work with, that's not the biggest concern, but they have significant difficulty eating. They're able to manage and help the food or liquid go down the right way for the food they're taking in, but they may not be taking in enough food, they may not be taking in enough variety in texture and nutritional requirements. So the next thing I wanted to talk about is how complicated feeding is. I already had mentioned that feeding is probably one of the most difficult things that children do. I mean, you're involving 4 major organ systems. You got the gastrointestinal system, the muscular system, cardiovascular and respiratory system. They're very closely related also. When you're swallowing, you're not breathing. And for us, that might sound easy. You know, we're used to coordinating that, but it doesn't come easy to everyone, especially kids that have had heart or respiratory issues. And then on top of that, you're also dealing with sensory, cognitive, and social emotional factors. And they all interact together to complicate things in all different ways. Children learn very early that eating hurts, it makes me choke. And there are actually neurotransmitters in the brain that turn off the appetite and tell the child, don't eat, it hurts you. And unfortunately then, later on, even if they're able to compensate, they've lost their recognition of hunger and how to regulate themselves. So that's again where problems can exacerbate, even from a child who just had difficulty early on as an infant, learning how to suck. Developmental milestones are important. I have a handout in here for you guys on developmental milestones like this. And this is good actually to give to parents if you need to. I would take some time and talk with them about it and try to explain. This one focuses mostly on the motor skill and how it relates to what's going on feeding wise and sensory motor wise. I have another handout that talks about the cognition and the social emotional factors, and I wish that I could combine them, and maybe someday I will, and we'll give that to you. Because they're they're actually equally as important. But, I mean, just looking briefly, I'm not gonna read the whole thing, because we're short on time, but, by 6 to 9 months, you're introducing finger feeding, spoon feeding for purees, actually drinking from a cup. It has it here 9 to 12 months, but I actually introduced it 6 to 9 months. 9 to 12 months, you're introducing cup drinking. If you haven't by now, eating lumpier foods, and chewing. And what's difficult here is you might have a 12-month-old that is functioning motor-wise at a 6-month level, and so they're not going to be able to manage the foods that a parent is typically going to want to introduce to a child at 10, 12 months. And beyond that, their cognitive age might be somewhere in between, and they might be starting some behaviors in terms of, I want to be more independent, but I don't have the motor skills yet to be independent, and it complicates it. So it's important to understand that all of these aspects are influencing a child's feeding, and to understand where they're at in each of those areas, to know where to come in and work with them for that. We talked about a little bit, but another major factor is the stress that feeding causes parents, and the pressure put on parents. I mean, as moms, we know we need to feed our children, and we also know how hard it is to prepare meals amongst everything else that we have to do during the day, especially if the child is not going to eat it. And then again, there are those cultural issues of some kids having bottles until they're 3 or 4 years old, and kids needing to eat a bowl of rice and beans this big in order to grow enough and to be able to eat it all in one setting. And so we need to understand that, and we need to be able to meet the parent where they're at there and help them make some slight shifts there. This can be very difficult. I find it more difficult than trying to change some daily routines to help build language and things, because again, it's so culturally based, and so emotionally based in terms of, is my child growing, not growing? Are they going to survive, basically? The next section is children who are at risk. I'm not going to read through this whole list, but if you look on there, you're basically going to see it's going to look like most of the kids on your caseload. Could be neuromuscular disorders, drooling, reflux. Reflux is something that's often kind of overlooked, seen as a minor thing, but my experience is that reflux can cause significant issues, and even silent reflux, where you don't know that's what's going on, and where the GI doctor doesn't see it happening, and it going on to create more problems. I guess I'll skip on to